Others face it head on with the proper tools to fight it. Here with some of those special deals on those tools is our good friend, Dr. Sonny O. Good to have you with us here once again.
Great to be here. Thank you.
You know, as we get older, you're still a very young man, but as we get older, we start to lose fat in our face. We start to lose muscle in our face. We actually start to lose maybe the control of things in our face, and our face has a tendency to draw in. How can we keep that from happening, or at least make adjustments to that?
First of all, thank you. You're very kind. That is one of the hallmarks of the aging process, is that we do lose volume in our face, and typically that volume loss is in the middle or centrally. So, you know, a way of looking at it is, if you're losing volume, one way to combat that, you know, is to restore some of that volume. And that's where I like to use a technique called fillers.
Okay.
And there are a variety of fillers available. And it's amazing how much advance there's been, because, you know, the fillers that are out there now, such as Restylane or Juvederm, can be very specified for very particular areas.
Sure.
These folds around
the lines.
Another great area that I've become very excited about recently is the hollowness underneath your eyes. So wherever you're losing volume,
and this lady right here, the pictures are amazing from the left to the right.
Yes. And this is a great example.
She looks 10, 12, 15 years younger on the right.
These are a great example of how things can be done. These are non-surgical. These are a combination of fillers, and I can tell that she's also had some Botox, because some of the lines that are especially between our eyebrows,
they're gone.
Are softer and almost gone. So, yeah, it's really a great technique, because it's not surgery, so you can have this done. It really has little or no downtime. I call these types of things truly lunchtime procedures, because that's how long it takes to get it done. Come in on your lunch hour, have it done.
By appointment, of course.
Absolutely.
You just don't drop in and say, hey, Dr. Sonny.
We'd love to see them gang rush the door, but yeah, I would recommend an appointment. So again, another example of a combination of using fillers to fill volume and soften lines, as well as Botox, which is the primary treatment for wrinkles. Now, I use Botox, but there are other wrinkle treatments available, such as Dysport. So, you know, there are certainly plenty of options. And when you pair these things with other non-surgical options to help brighten your skin, to help find wrinkles, to help remove dark spots, you have so many tools available to, one, either do things preventative or to actually treat a very specific area.
And, you know, sometimes this falls under vanity. People just want to look better. But it's also there that people still want to remain competitive in the workforce, and they want to remain young looking, because there's a bunch of younger folks that are coming in as well. So they want to still remain young looking. And there's, with what you're doing, is helping those folks stay young looking, so they can still, because they still ain't got that competitive edge. But as we know, you know, sometimes...
I think there's certainly a role for that in maintaining maintaining your appearance to for your job, as you said. But overall, as you had alluded to earlier, it's what it does to how you feel. And it's amazing. Little things can make a big difference.
The smallest thing.
Exactly, on how you feel. And it may not be, you know, dramatic like whoa or wow, but it really makes a big difference on how you feel. And a lot of times that will change kind of how you view things, or your perspective. So,
and you can tell the individual if a filler is right for them. And then, of course, as you're saying, different areas take different fillers, correct?
Correct. And that's why I would recommend a consultation, because this isn't a, you know, one size fits all. You know, the treatments are certainly customized to what the patients are concerned about. But also, you know, sometimes I'll see something, I say, I think this might help. And, you know, together we can usually figure something out.
Yeah, and I just recently knew about a lady through another friend that she had Botox into her forehead, and said you can tell her attitude difference is she's just so perky now.
Yeah,
she's very much more confident than what she used to be.
And
yeah, it's amazing.
Yeah, and it's a small thing, and it's subtle, but it makes a big difference.
We've got some things to also talk about. You've got some specials coming up this week only. Tell us about that.
One of the specials for the first 5 callers who are watching this program, we're offering up to $500 off any filler/Botox treatment. Actually, that's for next week if you make the call from watching this. But for the first 5 callers, people who register for our event, which is August 29th from 5 to 7, you'll receive 5 free units of Botox.
That's pretty cool.
Yeah, that's a great little deal.
That is significant savings right there.